New treatments are now available for patients battling an aggressive form of blood cancer. It's a much-needed therapy that's giving people a personalized approach to fighting the disease. Joining us today, Dr. Gordon and Megan Gutierrez. Thank you so much for joining us today.
Thank you for having us.
Okay, so let's start with some of the cancers specifically that we're talking about, blood cancer, and also what are some of these new types of treatments?
So large cell lymphoma is a form of blood cancer. About 80,000 cases of non-Hodgkin's lymphoma a year in the United States, which puts it somewhere 7 or 8 in frequency in the U.S. in terms of malignancies. Diffuse large B cell makes up about a third of those cases. And that's characterized by it being a very aggressive form of lymphoma, very aggressive form of malignancy. The good news with that is that 50 to 60% of patients might be cured with their initial treatment, which is an aggressive form of chemotherapy. But that leaves us with about maybe 40% or 50% that are looking for other treatments. Bone marrow transplant is one of those. But this new form of treatment, the chimeric antigen receptor T-cell therapy, and this we're talking specifically about Breyanzi, which was just approved by the FDA recently, is a way of weaponizing our T-cells, activating our T-cells or activating the immune system to fight the malignancy. That's very different from what we do with chemotherapy or radiation. So it's a novel approach based on probably decades of very sophisticated and exciting science.
That's incredible. I mean, some of the numbers still sound pretty scary, but then when you hear about this new option, maybe, Megan, you could touch on just what this means for patients to have this new treatment option.
Unfortunately, and as Dr. Gordon points out, diffuse large B-cell lymphoma is an aggressive or fast-growing form of the disease. And when patients relapse, they and their families often must make important decisions about their treatment very quickly. And up until recently, they have had limited options. As a result, new treatment options mean new hope for these patients.
So what does this new treatment entail if people are in this, and sometimes everything just kind of goes into a fog when you're hearing, the C word, what can people expect from it?
Right, great question. And you're right, it does go into a fog for people. First of all, I'd say my role here has been as an investigator on the clinical trial, the pivotal trial that led to the approval of Breyanzi, and neither Meg or I are compensated for our time here. But what it involves for the patient is basically starting off by sitting in for this treatment, sitting in a chair, getting their cells collected through a catheter that's usually inserted into the chest area. It's about a 4 or 5 hour procedure. Those cells are then sent to a central laboratory. Genes are inserted into those cells. The patient, when those cells are ready, it can take 2 to 4 weeks. The patient comes back, mostly in the hospital, but some patients can be actually treated as outpatients. Those cells are reinfused like a blood transfusion. And in the first several days, we're watching for some side effects, which are traditionally been either fever or a drop in blood pressure, which can be managed pretty readily. And then some patients may develop some neurologic side effects, transient neurologic side effects that also can be managed fairly well. So I think for the patient, it's understanding a whole new approach to treatment where we're not using radiation and we're not using chemotherapy. We're using their own cells, which, as I said, have been weaponized against the lymphoma.
It's interesting, and this is where clinical trials come into play. I mean, there's so many other things going on in the world right now, but it's great to know that there are still these trials happening and really changing the way that we treat and attack cancer. If people want more information on learning about this type of treatment and other treatments similar to this, where can they find them?
So I think number one, talk to their oncologist to see if a clinical trial is available, but we routinely work with Meg and the Lymphoma Research Foundation to provide objective information about the disease. And so we work hand in hand with Meg and LRF to try and provide that information for patients.
Oh, it's incredible.
Thanks, Dr. Gordon. I think that's right. We would encourage patients and their families to visit our website, that's lymphoma.org, where they can learn about every type of lymphoma, including a dedicated diffuse large B-cell lymphoma learning center, We also have materials about all of the different treatment options currently available, including, importantly, as you point out, clinical trials in CAR T-cell therapy. Experts like Dr. Gordon help advise these materials. Our helpline can provide one-on-one support and resources. And I'd like to point out that these materials in all of our programs are always available free of charge.
Well, Dr. Gordon, Megan, thank you so much for your time today. I appreciate it.
All right, thank you.
Still ahead, we're celebrating our rich agriculture history as we look at the new things going on in agronomy at the University of Minnesota Crookston.